So it wouldn't be a webinar related to healthcare technology in May of 2026 if we didn't hit on AI
Of course.
and AI's relevance to the prior authorization process.
We could not call ourselves tech nerds if we didn't talk about AI.
Of
Because
course.
everybody talks about AI these days.
And for good reason, because it is an incredibly powerful technology, and it has the opportunity to create a lot of good, and particularly in the prior authorization process.
Sure.
I think we see a lot of opportunities for it to really expedite the process, for it to save money for certain stakeholders involved in the process. So where do you see AI really fitting in with the prior authorization process in healthcare in the US moving forward?
Literally everywhere. I mean, the reality is that if we aren't already seeing it at every step in the process, we will. I know we definitely are in some aspects already. So if you think about it, prior authorization has a variety of steps that have to, happen. And we've reviewed that in other videos and such. But it starts ultimately with a decision by a clinician to pursue some type of intervention. That would be a procedure, a test, medication, something like that. And that determination is, now being driven not only by, clinician judgment, but at least in some ways assisted by AI tools. You have AI-driven clinical decision support. You've got tools like open evidence that allow providers to be able to find medical information and research, hard to treat sort of conditions or rare diseases much more effectively. So we've got these AI solutions at the point of care that's influencing what type of, again, intervention or medication might be utilized in a patient's course of treatment. Now you're going to see AI being injected into the process of, okay, how do I make this determination of whether prioritization is needed or not, and then what information is needed to be able to actually support that prior authorization request. So AI is going to, I believe, be used inside of EHRs and other systems to search for the right documentation, help find those pertinent tidbits to supplement that case by the provider. And then once that prior authorization is in the hands, that request rather is in the hands of the payer, they're no doubt will be using AI to be able to analyze that prior auth request, identify maybe gaps or needed documentation, and ultimately probably making a decision or assisting a human in making a determination on whether to approve or deny it.
Yeah. I think that the important thing that, we want to kind of emphasize here is that, it's up to us as the health IT community to make decisions about how we allow AI to influence the prior authorization process.
Yes.
I think I could see a world where, as I said earlier, that it's used for a tremendous amount of goods. You talk about, practitioner offices having people on staff whose entire job it is to fill out prior authorizations.
Yes.
You talk about physician burnout rates being a recent AMA study or survey indicated that some significantly high number of physicians ranked prior authorization as their top reason why they're ready to retire. It's really impactful.
Massive headache, right?
Massive headache. And we can see a world where, AI really ameliorates some of that.
And also maybe leads to faster decisions, hopefully,
right.
so that people get an answer that they need more in line with what CMS has, been
right.
proposing in the new proposed rule.
Right. The flip side is that we don't want to see care that is clinically appropriate being denied.
Yes.
Right.
Of course not.
That's a really critical thing we want to avoid. And, if left to its own devices, unregulated, that's a risk, So I think that there needs to be some regulatory intervention. We need to continue to press for oversight and transparency into the prior authorization denial rates and approval rates.
Yep.
Hopefully we'll be able to see from some of the additional proposed changes that we've discussed previously as far as prior authorization reporting for pharmaceutical drugs, how, AI adoption will impact that.
Yep. And I think, Sam, we are seeing this being used in the wild, and I'm thinking of CMS's WISER model, right? WISER program that they've just started. I don't know if you wanted to hit on that for a minute and talk about how unique that is.
So it's a relatively new model that is focused specifically on taking technology from the private sector and deploying it within Medicare's traditional fee-for-service insurance plan.
Yep.
So it's starting with a small subset of very common in clinical products and services, right? So a couple of different surgeries. I think back surgery is one of them.
Right.
And the goal of this is to see how these different technologies deployed across, I think, at least 6 different states
Yes.
are able to improve and expedite the process of prior authorization by using various AI technologies to triage, automate aspects of the assessment of the medical necessity of a prior authorization request.
Yeah. So, and you're already seeing reactions. I mean, there were strong reactions in the community when the Wiser model was first announced. Because again, as you mentioned, Sam, this is unusual, not unprecedented. Traditional Medicare has had prior authorizations for certain things in the past, but this kind of cracks the door open to, introducing more prior authorization and then also bringing AI into the mix when it comes to, driving those prior authorizations and that process forward. So we saw reaction when it was announced. We've seen reactions and feedback since it's, started. I think Patty Murray, one of the senators from the state of Washington, put out a report talking about care delays and other impacts. So it's going to be very interesting to see how the acceptance of AI when it comes to prior authorization plays out.